It's different for everyone, but I do recommend that everyone have a mentor. I mean, think about all the sports players out there, and they have their coaches and mentors, and executive leaders in hospitals have their coaches and mentors for leadership.
Hello, welcome to Scrubs Unzipped. This is your host, Anne Marie, and today I have a special guest. Her name is Dr. Cole, and she's known as the Healer's Healer. She's an award winning physician, executive, visionary healthcare advocate, well being specialist, author, speaker, and podcaster. Welcome, Dr. Cole.
Well, thank you so much, Anne Marie, for having me on your podcast today. I'm really excited about our
Me
discussion.
too. So, can you tell me just so that the audience knows like a bit of a background about you?
Oh, absolutely. Well, I'm an osteopathic physician, and I went to school in Des Moines, Iowa, my hometown. And I then did a residency in psychiatry. So I'm actually a psychiatry specialist. And, my journey kind of took many different avenues in healthcare. I specialized in women's mental health for many years. And then I had some of my own autoimmune issues that I had to deal with. And that's when I started getting into holistic medicine and integrative medicine and applying what I was learning to myself, to my patients, and realized that integrative mental health care was providing so many more solutions and helping to reverse disease and illness in my patients. So I went down that path and got certified in integrative medicine. But yes, and so I was in California and I practiced functional integrative medicine out there. And I had been in hospital leadership throughout my life as well, and I had an opportunity to be a chief medical officer of a hospital facility in California, and I couldn't believe how toxic healthcare was becoming. And in that position, it was very challenging for me as a leader to even make positive impact and changes. So that was right before the pandemic with COVID. And so I used that time to sort of reinvent my career. And I wanted to really think about, as a physician, like, how do I want to show up in healthcare as a leader, and where can I make the biggest impact? And what I was seeing at the time, and I also had been coaching physicians for 20 years as well. So I was a physician coach. And at the time, all of my doctors, I was basically coaching my doctors out of healthcare. I had all these women physicians coming to me as executive leaders of healthcare systems saying, I'm not making an impact. I'm not able to do what I want to do. It's a conflict of interest. I'm experiencing moral injury every day. I can't keep this up. I can't manage a family, raise children, and be a daughter to my parents who have health problems and continue to be in this toxic workplace. So I sort of went down the rabbit hole of, healthcare burnout, and was very grateful for the community that I met out there, because I became very inspired about all the solutions that are taking place to try to heal our healthcare system and culture of medicine. And I think that's when I decided to dedicate my passion and my career to really, you know, keep physicians in healthcare and keep our healthcare professionals in healthcare. And what's it going to take to do that? Well, there are solutions that are going to come from all over the place, including frontline solutions, individual solutions, and systemic solutions. And so I launched my own podcast called Hope for Healthcare. And it's a podcast in which I interview experts around the nation about what they are doing for their own healthcare system and their own physicians that they're coaching as well. So that's my
Wow, you
story.
do a lot. Like I do like a round of applause for
Thank
you.
you.
It's one thing to be a healthcare worker and have a job and basically like this is my paycheck. But I can tell like this is like your true passion and your
Mhm.
motivation is more than money. Is that correct?
Mhm. Oh, absolutely. It breaks my heart to see what's happening in healthcare today. And, it breaks my heart for patients who are experiencing disconnection with their practice team. And my heart is breaking for physicians and nurses and all healthcare professionals, and even leaders who feel like, they're in a position where they can't really impact change. So I think, I'm very passionate about trying to be part of the solution and not continue to show up as part of the problem.
Mhm.
And that was a decision that I made several years ago. So
And you also mentioned, oh, what you say?
I was part of the problem,
Hmm.
and I think in that sense, I, as a leader, I wasn't aware of the systemic solutions that are necessary to reverse burnout in a healthcare system. And so I was causing problem for my healthcare system because I didn't know the solutions that existed. So becoming educated and aware of what other healthcare systems are doing to really create a more positive and nurturing environment, I think is key for all of us.
That's awesome. And I also want to rewind when you were introducing yourself. You said that you use integrative medicine to like help heal yourself and help heal your patients. Can you tell me how you did that?
Mhm. Yeah, well, I mean, it was it was a slower process. I, had a thyroid autoimmune disorder, and I ended up, in residency really struggling with a lot of weight gain and water retention, inflammation, and it led to other inflammatory disorders as well. And at the time when I graduated residency and I moved back to Kansas City, I had a great neurologist and healing team, and they really worked with me on my diet and nutrition. And, we were trained completely differently in medical school about nutrition. And so I had to learn a whole new way of eating for my body, more plant based, whole foods, organic, dairy, gluten free, things like that to really minimize the inflammation that was happening in my body. And what happened is, I reversed my autoimmune disorder. So I no longer have it, and I was able to get off so many medications. And so slowly I started saying, well, if I can heal my autoimmune, what if, my patient with bipolar disorder, what if we start working on diet and nutrition? And, over time, within a year, a lot of my patients were coming off their diabetic medications or hypertensive medications, and all because of nutrition. So it really made a big impact on me. And that's when I decided to get more additional training in that.
Wow.
So.
So I it kind of hits home for me because during COVID, like I was treating patients because I'm a respiratory therapist. So I was treating patients, and then in turn, like I became a patient in a mental health facility because I had like a lot of anxiety surrounding like death and just like I was exhausted. Like even before COVID, I was already exhausted, and then once COVID happened, it's just like the jig was up. So how do you
So sorry you
oh,
went through that, Anne
thank
Marie.
you. Like it's just like that's why I have this platform here, Scrubs Unzipped, is because I want other healthcare workers to find their passion beyond their job because sometimes we identify as a doctor or a nurse or a respiratory therapist. Like that's not who we are 100%. Like 100% we are human first, and then we add on extra stuff in the end. And I just want to know, like, do you have any like when did you have to like overcome, like when you had to like use resilience to
Mm.
go forward?
Oh, wow. That is a very deep question, Anne Marie. I'm gonna share my story because I think that we empower each other through showing up and being authentic and vulnerable. And, I overcame a lot. So, I had a very traumatic childhood. I had a lot of abuse I had to overcome and heal, and PTSD myself. And luckily, I chose psychiatry. So I was surrounded by wonderful mentors and healers and therapists to help me through that. And, I think in being in healthcare too, I also suffered, some toxicity and manipulation and mental abuse in the healthcare workplace, of course, and had to work through that. I also, lost my mother to breast cancer a month before med school started. So it took me about a decade to grieve actually because I was so busy. I didn't have time, and it caught up with me, which is part of the reason I think my autoimmune disorder flared in residency. And then I lost my father to suicide. He was an oral surgeon and he took his own life in
Wow.
2013. So I've certainly been through a lot. I've had a lot of trauma in personal relationships, professional relationships. So there's been a lot in my life that I've had to overcome. And I can't imagine doing it any other way,
Mm,
right? So when we have trauma, we have two choices. We can either allow the trauma to fester in our body, our physical and mental and emotional bodies, and eat at us over time, or we can process the trauma and release
mm.
it. And so I just sort of dedicated myself to being on this really tough healing journey. It's not always easy, but the reward is permanent
Mm.
healing.
And that's
So,
like you had to go through all of that and now you're here. Like it just shows like how the human condition, how we can just like make it
mhm.
through. Like what are did you have like a mentor to help you or multiple mentors to help you along the way?
Absolutely, Anne Marie. And I recommend everyone have a coach or mentor or somebody they can talk to. It doesn't have to be a therapist. I know for me, therapy didn't really work that well because I was already a psychiatrist and I'd been through therapy since I was in and out since I was 16. So, for my own personal journey, I turned to more spiritual healing and advising along with, leadership, personal and professional leadership development and coaching. So that combination really, I think, helped pull me out of my trauma. Plus, I did more intensive trauma healing techniques as well, including hypnotherapy, and that was very beneficial. So it's different for everyone, but I do recommend that everyone have a mentor. I mean, think about all the sports players out there, and they have their coaches and mentors, and executive leaders in hospitals have their coaches and mentors for leadership. But if a physician is struggling, and we're asking for support, we're considered
Mm.
weak. And I had one executive CEO of a hospital tell me one time that by the time one of his physicians needs coaching, they're already ready to terminate them.
Wow.
So it's really important to think of coaching and mentoring as more proactive and preventive, and leadership development, I think, or personal development versus, oh my gosh, I'm at the end of my cycle, I'm feeling suicidal. I think now it's time to get a therapist. I mean, it's almost it should be something that we support as a culture to be more proactive along the way.
And I think I was at that point too where well I had multiple like instances. I could be like one of the crazy ones, but I'm
The word crazy, so just that one out there. We're all human. I myself has been suicidal. I've talked about that openly too, and I was very suicidal at a point in my life, and it was due to being on an antidepressant that triggered some of that for me. So I was lucky that I had a good support team around me to help me identify what was going on. And but I want to hear more about your story.
Yeah, so I've had multiple traumas, and especially when you're a respiratory therapist, you're called at the bedside when something is bad is happening. So, like having that anxiety, I've actually, how you said, like the cycle, like I'm more attuned to like if I'm doing these certain things, like I know I need to check myself and to actually know where I am so that I don't go down that dark road again. Or if I do, make sure I call for help or I make sure I take care of myself. So I want to ask you, like, what do you do to take care of yourself when things are going bad?
Oh boy, lots of things. um, I think if we're real people and we're authentic and honest, every day is like a little bit of a roller coaster of emotions and waves and thoughts and feelings and behaviors. And every day, I experience extreme sadness, grief, pain. Every day I experience anger and frustration, and every day I experience happiness and joy. And some days, the happiness and joy pretty much wins, like it's
Okay.
most of the day. And other days, that suffering, grief comes in. And sometimes I don't know where it's coming from. So for me, I think checking in with myself every day is just really important. And if I start to have an emotion that feels uncomfortable, instead of pushing it to the side, I kind of ask my system like where it's
Mhm.
coming from. And sometimes, because I'm an empath and you obviously are too, that we take on other
Mhm.
people's anger and frustration. And of course, if we have a good friend that's suffering, or, we're going to take that on, and we have to really monitor
Mhm.
that and make sure that we're not feeling something that isn't ours to feel. So that's the first thing I do. And then if it's going to be a day where I just have some grief, then I'm going to ride the wave. And if I'm in clinic or seeing patients or coaching, sometimes I'll set aside some time later to look at it. So I kind of put it in a bubble and tell myself, you know what, tonight I'm going to do like some journaling and really check in and see what's going on. So I set those boundaries around that, because sometimes you have to function in a day and you can't just take the day
Yeah.
off. So I have several coaches I work with. Um, One is a physician executive, and she works with me on my leadership
Mhm.
development. I have another coach who specifically is there for me to understand more about like sociopathic and narcissistic dynamics, which I have in my family. And I've encountered in healthcare a lot too. So she helps me identify those patterns. Um, and I have a spiritual healer that I see as well. So that's how I take care of myself, and lots of body work, massage, and, you know, um, I think the most important, the hardest lesson that I am still learning is self compassion. And I struggle with that daily. I'm going to be honest.
Mhm.
So I think that is the number one foundation to self care, is just really having compassion for yourself and knowing that, you know, we're all human. And, today I'm supposed to be a doctor in clinic, but I'm also a human being, and I'm struggling today. So I'm going to have some compassion
Yeah.
around that and maybe cancel my plans for tonight and stay home and just kind of nurture myself. Um, so I think that is probably one of the biggest lessons I've learned in my career.
Wow. And I want to talk about like spiritual healers because sometimes it's like
Mm.
you can't really like Google, you can, but not really. And then like insurance and all of that. So, how did you find your spiritual healer and what does that entail?
Well, yeah, when it comes to energy medicine and energy healing and spiritual healing, I think it's very personal. And just Googling somebody or researching somebody on the internet, I don't think is enough. I think, for me, it was my best friend at the time worked with a spiritual healer, and she recommended her for me. And I had never done anything like that before. So I got introduced to energy work. And then I decided to become certified in Reiki energy healing. And then I met my mentor in Reiki. And so I think for me, I've always found my healers either energetically, or I get a referral from a friend, or um, something like that. So, but starting out, I think it's best to try to get a referral
Okay.
initially.
And then, so how do you collide that, like energy healing? I guess, like I hear it as like the woo woo. Like, how do you
Yeah.
collide that, or how do you like equalize it with like your profession as a psychiatrist? Like, how can they work together, or how does that work?
Well, I think spiritual medicine um, flows very well with integrative healing and traditional medicine. They work together very nicely. I chose to get trained in Reiki, which is REIKI, through the International Center for Reiki, or International Center for Reiki Training. And it's they have like decades of evidence showing how Reiki can really improve healing. They have a lot of hospitals now are actually hiring full-time Reiki practitioners to be available to do energy work on patients before surgery, because they found that Reiki can actually decrease the amount of time you're under anesthesia. It can decrease comorbidities from the surgery, any complications. And so a lot of surgeons are requesting Reiki healers before and after surgery. Reiki is found to be very healing in palliative care and end of life care too for patients, and helping them transition more peacefully at the end of their life. So, in that sense, we have a lot of data and evidence to show Reiki in healthcare. Um, from a personal note, um, I think I use my energy on patients more in terms of helping me get in touch with my intuition. So Reiki can also help you access your higher self and your intuition coming in from God or whoever, you, higher, whatever higher power that you believe in. Um, so I think that makes a difference, because especially in psychiatry, a lot of times my patients don't really tell me everything that's going on. But I can sometimes see their energy fields. I see pictures playing. I see things happening, and I have a better sense of, maybe they are getting ready to attempt suicide, but they're not going to tell me about it. And I can actually then bring that up. So I found it to be very helpful in my practice.
Mm. So I want to change gears and ask about, why do you think there's such a stigma about like burnout in healthcare, like as a healthcare worker? Like, why do you think there's such a stigma about showing compassion to ourselves, like we show compassion to our patients?
Well, I think it's multifactorial. Number one, I think our culture of medicine makes doctors and nurses and healthcare professionals wrong for showing up and being overwhelmed and being checked out and being burned out. The system and culture has made that to be a mental health
Mm.
issue. And it's not. So burnout, according to the World Health Organization, is due to systemic factors to the job circumstances. It has nothing to do with depression or mental illness. It's a separate entity. Although, of course, depression and anxiety, can coexist with burnout, and burnout can increase risk of having depression and anxiety. And then if you already suffer from depression, anxiety, or bipolar, you might have a higher risk of developing
Mhm.
burnout. But they are completely separate. So burnout is a job related stress. And so I think the culture has been misinformed on the definition of burnout. And so a lot of executive leaders, when they hear that their physicians in the ER department are burned out, the staff in the ER department's burned out, they're like, "Ugh, we threw them a pizza party and we bought them like fuzzy socks last month. I mean, wasn't that
Yeah.
enough? Jeez. What else do they need? Should put kitten posters on the wall? I mean, they are so
Mm.
disconnected and clueless when it comes to burnout. They have no idea how the EMR has shifted, administrative burden for everyone, and that we're understaffed, and even in respiratory therapy during the pandemic. They had no idea what you all were going through. There was such a disconnect. They're sitting in their
Yeah.
office, they weren't on the front line shadowing. So I think all of those factors contribute to that. And I know for physicians, when we go through medical school and residency, um, there is absolutely no compassion for having a bad day and being human. And I could be vomiting with a fever and I'd be expected to see patients all day and around for 16
Wow.
hours. So we're boot camp trained to be absolutely miserable and function in a 16-hour day.
Mm.
So we have to unlearn that programming. And that's part of what I think coaching and mentoring can do. And what I do with my physicians is I say, that that old way of being is not sustainable for your 55-year-old body, right? I mean, you're already working 14 hours in clinic, seeing 35 patients a day, and you're coming home and then you're on your computer documenting until 1 in the morning. And you've been doing this now for 15 years
Wow.
straight. Like, this is not sustainable. And so I think as physicians, we have to wake up and realize what is happening. And then, create an environment that's going to be more nurturing for us. And that's a whole other subject.
Yeah, so I'm doing my part in having this podcast and all of my I wrote a book as well, and you're doing your part. So I guess like we're all doing like what we can and chipping away at it because there's definitely more awareness of burnout and moral injury and et cetera, et cetera, et cetera. But like I feel like the future is kind of bleak for healthcare. Like, I don't know. Like, what do you think?
Well, yes. I mean, I do. So the future is not only bleak for our current healthcare system, it's annihilating. Our current healthcare system will not exist in another 50 years. There's no way. It just won't. So I think when people talk about, oh, our healthcare system's imploding, yeah, it's imploding. I mean, it's not sustainable. Now, there's like 5% of healthcare facilities that are actually doing something in the United States. So 5% isn't bad. I'd like to see it more at 80%, but
Or at
we're
least
getting
fifty
there slowly.
fifty.
Like latest stat, I think like less than 5% of
Wow.
hospitals even have a well-being committee, right? So the healthcare systems that are really prioritizing humans first and taking care of their care providers. And when the care providers are taken care of, we take better care of our patients. So when they recognize that, then I think that system is a new system that's being redesigned and it's parallel to the one that's already existing, if that
Mm,
makes sense.
yeah.
So the new system that you're part of, I'm part of, our well-being community is part of nationally, we're redesigning healthcare to take us into the future. But unfortunately, 95% of the healthcare system is still operating the old
Mm,
way. And it gets even more complicated. In those 5% of hospitals that have chief well-being officers and committees that are doing evidence-based strategies to try to reverse burnout at a system level, they are still operating in two different
mm,
systems. So my friends who are chief well-being officers, and this is the thing we talk about because that's one of the top burnout reasons for chief well-being officers right now, is that they're trying to redesign this healthier healthcare system on a foundation that is so
mm,
broken. And so you're existing in two systems at the same time while you're trying to get this new one up and running. And it's a 5 to 10 year process. Like the VA, the Veterans Health Administration, they are doing this national campaign for well-being for the veterans employees, and they have an 8 to 10 year
wow.
timeline for change. So I I understand where you're coming from, where you say healthcare is bleak, and I feel the same way. But I think it's so obvious. But the new system that's being redesigned, I think, is much healthier. And I think competition is there's more going on behind the scenes. So I think competition is going to come into effect. So I think in another oh, exactly, like in another 20 years, you know, maybe we'll be up to 30% of hospitals are dedicated to shifting. And those hospitals are going to be the ones that are never understaffed. People are flocking to those hospitals to work
Mm,
because they know they're going to get taken care of. They know that they're valued. They're not going to go work at the hospital across the street that's still
mhm,
crappy and abusive and toxic and making doctors see 35 patients a day. They're not going to go there. They're going to go to this other hospital,
yeah.
right? Across the street. And so competition is going to kick in, and then we're going to have more doctor owned practices again in facilities, and that's going to make a difference too. So I think, we are going to see a shift, but it's going to take time.
Yeah, and I can tell the difference because I was a travel respiratory therapist, so I got a chance to go to many different facilities and help them out. And the place that I'm at now is like night and day. Like the way that they treat their
Wow.
staff is much better. Like there's still room for improvement, but I can tell like they're actually trying, and their mission is actually people first, children always. So I feel like if you have a culture of people first in organizations, then it will be, I'll say, like, it will be a brighter future. But you said there's 5% who are doing this thing. So we just have to give voice to the healthcare professionals and let them know, like, I don't know, you might want to move to the 5%. You might want to move to the 5% areas so that you can have a better well-being and you can be able to take care of your patients. Because if you don't take care of you, like, you can't take care of patients. Mm.
So how does people first, children always, how does that culture that you're working in impact what you do every day? How have you seen a
So
difference?
I've been working at this facility for like a little over 6 months, and they have a well-being center, and they do like checkups with us. Like, we have peer groups where we can like talk about things that are going on. We also have mentors. We also have a support center, and it has a gym, and it has trainers, and like, they really, because I work at a children's hospital, so children can like see through the BS. So I guess like they really want an effort on, let's take care of the people, and the people will take care of the children, because children are just so cute sometimes.
Oh, I love that, Anne Marie.
Like, the kids are just so cute, and it's just, um I guess because I worked with adults before, so working with children is like a different population, and I was not used to working with kids and seeing their parents and doing all this extra stuff. So like, I'm glad that I have the support of the organization, and it really makes a difference because I go
Yeah.
from hospital to hospital. This is like the first time like I've been in one hospital for a long time. So I guess it's working.
Well, I mean, it sounds like you also have that peer support, which makes a difference, and you have somebody checking in, and if you've got it, and see that simple
Yeah.
shift in your healthcare organization's leadership philosophy, with it being people first, children always. It includes staff, it includes nurses, it includes respiratory therapists, doctors. So I think that it just holds everyone
Mhm.
accountable, right? People first. And so it's in the back of your mind, right? It's subconscious and
Mhm.
conscious. So they probably have the motto on the wall
Yeah,
all
they
over the
give us free
place, right?
t-shirts.
Yep. So, and like you could be having like a moment where maybe you're irritable with somebody, or a doctor might be frustrated with their nurse, and then they see the people first, and they're like, "Wait a minute, are you?" They might even think to ask their nurse, "Are you having a bad day today? Something's off with you. Is everything okay?" "Oh no, my mom just got diagnosed with
Mhm.
cancer." "Oh my god, I'm so sorry." People
Yeah.
first, and like I have, and they teach us that in leadership development too.
Okay.
Is always, somebody is having an off day, to really just check in with them, and you know, because we all have our moments. So I really love that. I wish more hospitals would
I
do that.
wonder, like, why don't they? Like, if they see the retention rates are bad and they see like the where they're going is bad, like, wouldn't they profit more to keep all of their staff? Like, what have you seen?
I think that's multifactorial. I think a lot of that has to do with the boards and the
Mhm.
CEOs. And a lot of the CEOs are in their 60s and 70s, and they just have a different, I mean, pizza parties and kitten posters works. It worked 30 years ago. It's going to work
Oh,
now. Keep doing
wow. Well, we're gonna have to work together so it doesn't do that. we need to get.
it. I'm not very positive about that right
We
now,
need.
but no, I think it's multifactorial. I mean, I just think, I've seen chief well-being officers, they have to make the business case for well-being. And we have data going back 20 years with Tate Shanafeld he's not out of Stanford. And even Krasinski with the American Medical Association. I mean, they've been studying retention and profitability through taking care of employees for 20 plus years. And Tate even wrote a paper called The Business Case of Well-Being. And I use that in my presentations to healthcare executives because, we have the number crunching, we have the algorithms available. You can take a look at, for every one doctor you lose a year, it costs the system now up to $1 million to replace the doctor. So if you have like 20 doctors leave because they're burned out, that's $20 million. And you can start a well-being program for under $1 million. So if you can retain one doctor, they would pay for the well-being program for the entire year.
Wow. Wow. I did not know that.
Or retain two nurses and have another $1 million. Keep two nurses and one doctor and have $2 million.
And then it's just like, I guess we just have to wait for this generation to die out in the next 10 years.
Well, I think it takes a whole culture, right? So it takes you doing your podcast. Thank you so much for doing this. And it takes, you know, executives out there doing their coaching work with CEOs. It takes doctors and nurses and healthcare providers listening to these podcasts and going, wait a minute, we could make some changes on our own hospital. What would that take? And having everyone wake up a little bit to what is really happening with the well-being movement. And then I think that would make an impact.
And I think now, like this generation and generations coming up, they're less likely to stick with the status quo. They're more likely to speak up, and I think that's a good thing about our generation, like speaking up and not suffering in silence.
Oh, yeah. So 1 out of 4 medical students currently has no intention of either doing residency or practicing clinical
Oh,
medicine.
really?
Mhm.
Wow. So, what does that mean? Like, how do they
Yeah.
get their training if they're not a resident?
Oh, well, they'll finish medical school, but they'll do research. They'll do something else with their medical degree. They're not going to go to residency. It's so
Oh,
toxic. They're seeing it on rotations.
wow.
Yeah. So the millennials are, I mean, I'm really grateful that they're awake and aware, and they don't tolerate toxic work environments. They don't tolerate sexism and racism on the front line. And, that stuff is still happening daily. I mean, it was happening at the hospital I worked at in California on a daily
Mhm.
basis against employees and patients. So, thank you, millennials, for standing up and saying this behavior and these environments are no longer, we're not going to tolerate that as a generation. Like we want work-life
Mhm.
balance,
Yeah.
and make a difference. I think that too. Well, we're just not going to have doctors. I mean, um, over 50% of physicians are 55 years and older right now and have a 2-year plan to retire.
Oh, wow.
And then, we've got 1 out of 4 medical students now that have no interest in practicing clinical medicine. And then we also have over 50% of women that graduate residency cut back or quit medicine altogether because they can't see 35 patients a day and raise a
Mhm.
family, and they're not willing to do it. So we haven't seen the great resignation yet.
It's
It's
coming.
coming.
Because I think it
Yeah,
has to break first before there can be like rebuilding. Because keeping up these two models at the same time is not going to be effective. Like, what do you think? Like,
exactly. Well, if it's in the system that has the two models but they're trying to switch over, I think it is sustainable. But I think in the other 95% of the healthcare systems that really don't have a 5 to 10 year plan to turn things around, I think it's going to really impact them. We're already seeing it. I mean, hospitals are already shutting down. They're shutting down OBGYN, surgical centers, hospitals, wings of hospitals. They can't keep the hospital
hmm,
full. Patients are choosing to go to another hospital that takes better
yes,
care.
and like
Um,
the HCAP
sorry.
scores. So, what advice would you give like other healthcare workers who are they're in their job but they don't know like how to bring that culture in?
Well, if you're interested in making an impact and a difference at your current facility, I recommend finding a sympathetic C suite leader. So maybe a chief nursing officer. If the CEO is sympathetic to well being, then great. If not, maybe a chief nursing officer, chief operating officer, somebody in the C suite or high up in leadership that really understands this concept of retention and how profitable this is for a healthcare system, and working with them maybe on maybe just even doing a baseline evaluation of the healthcare system to see where everyone is, or looking at how many people left due to burnout. Looking at the exit interviews and pulling the data. That can always be a good place to start. I also recommend getting a coach or a mentor as well to help you with your own leadership development, help you set better boundaries at work for yourself. If you're feeling like you're at the end of your ability to manage, or feeling like, why did I go into this profession and have like $400,000 in debt, and I can't, how am I going to do this another 30 years? That's when physicians get
Yeah.
suicidal. So there is hope. There are a lot of different things you can do for yourself. You can do clinical medicine part time, do something else part time. So you've got that balance. You're not feeling so overwhelmed. You can cut back your hours for 6 months and just take a little bit of a breather to think about what your next steps would be. Talk to somebody that is a mentor within your facility that may have some impact too with your own team.
Those are great suggestions, and I take my suggestion too because I started my side hustle, and I think everybody has their own little side hustle that they're doing to supplement at least an extra shift, so you don't have to work overtime, so you can actually do this other income generating, like using your knowledge as a way to generate income instead of like signing up for extra shifts all of the time. And I just like I guess I would say that I've been in the healthcare industry for like 10 or 12 years, like over a decade, and I'm looking for my exit plan. Like um it's just like the place that I work now is great, and they're moving towards like they built like 17-story hospital, and it's just like they're growing. But I guess me personally, I feel like the 24/7 of the hospital is just like a lot, and I would probably be better like if I was a teacher or influencer and be a YouTube star.
Yeah, well, I mean, and this is a sad thing, right? Is that, I think a lot of healthcare professionals are where you are. And that's, I mean, I've almost left medicine like 5 different times in my career. I've just been like, I'm done with it. And, I keep coming back to what happens when we all leave? Like, who's going to take care of our patients? So, how can we keep healthcare professionals in healthcare? Maybe not full time, maybe part time, but how can we still keep everyone, continuing their journey in healthcare while creating happiness and joy for them too? There's got to be a balance. So I think that's, kind of the path I'm trying to work on, because, you know, I I don't want to see our country not have access to healthcare,
Yeah,
and we're already there.
yeah,
So
and I realized that what I do is important. It's just like the day-to-day monotony is kind of getting to me. And
yeah.
like I don't know about you, but like sometimes you have like these chronic patients and you see them like every single day, and they have the same issues over and over, and it's like, what's going on outside? Like you just want to like you want people to get better, but they're not getting better.
Well, and that goes back to integrative medicine. So traditional medicine is the sick care model. So our medical culture has trained patients to not take care of themselves and to continue the same patterns of whatever they're doing to, harm their bodies. And we have not trained our patients to be independent and to take personal responsibility for their health. We also have not taught our patients that there is a mind body connection to illness. And when people have respiratory problems, a lot of times it comes down to, I can't breathe the life that I'm living, right? That's what asthma is about. That's what COPD is about, lung cancer. So on a integrative healing, that's why I chose to go into integrative healing as well, because I have a little bit more hope. Because then I get patients that come in and they're like, yeah, I want to change my diet, nutrition, and I want to reverse this, autoimmune disorder. And it makes a difference because people do get better and they heal, right? But in the traditional medicine hospital model, it's
Yeah,
sick care.
not healthcare.
We're throwing medicine at them and treatments after they come in and they're sick. We're not addressing the root cause of what's causing the illness,
Yeah.
right?
And
Yeah.
I can relate to that. And sometimes I don't know, like there's a certain place like if you like break an ankle or something, like okay, you're gonna go to the
Yeah.
hospital. But if you like if you have this kind of disease that's kind of like generational, like if you have bipolar or depression or diabetes, that's a generational disease. Like there has to be some kind of mind shift, and like there's not really much help with that. Like you have your mentors and stuff, but mentors aren't cheap. Like they charge you money. There's not many free mentors out there, and it's just like the frustration is having the mindset of I want to change my diet, I want to change how I respond to stress, but like I don't have the mindset yet. Like, because I was speaking like for someone who's suicidal or they really don't want to live, like that Coke is the one thing that'll help them get to the next day. Like, I don't know if you have like used food in that way, but I've known people that use food to make it to another day. Like,
Oh, I'm right there with them. Absolutely. And it's, well, I think as a psychiatrist, I put my psychiatrist hat back on. Um, I think for my patients, when they're at that point where they're using food because they can barely get it to the next day, that's not a good place. So I'm really worried about my patients at that point. And I minimize medications, but I definitely get aggressive with medication when my patients are feeling that way. I have no problem doing that. And, when people are at that point, there's no way they can comprehend changing their lifestyle, right? It's taking all of their energy and life force just to survive and get through
yeah,
the day and not kill themselves. So they have to get their depression treated. They need to see somebody. They need some help. They need to get in a better frame of mind so then they can start thinking about, wow, I want to really flourish in my life. I want my body to flourish, my mind to flourish. And now that my depression's better, I'm going to start by making one change a month and see how that goes,
yeah, like
you
one
know?
step at a time.
So that would be, yeah, because I've been there
and
myself.
and I know that like your stories you've had like I'd seen like everybody has some type of trauma, and like there's no I wouldn't say that there's no, but I would say it's not as talked about as much because it feels like I have a like there's people who have a scarlet letter, like it's kind of like you're you're burnt out, you have all these things going on, but some people don't have like real friends anymore because it's like you're talking to about the internet and everyone wants to be an influencer, but it's only showing the best parts of yourself, not showing like the bad parts. So people have like a different perspective, like they're saying like, on Facebook, my friend is just like living it up, but they don't see behind the scenes. And I think that's another way because when you look at energy and stuff, what you feed yourself definitely like shows up in your life. That's what I believe. Like whatever goes in comes out. Like mentally, like what you listen to, who you're around. So I don't know.
Well, absolutely. And so, we are the average of the five people we spend the most time with. Now take your kids out of the equation, maybe your partner, but at the same time your partner is part of that. Five people we spend the most time with. And I know in my life I've had to look at that deeply because I've had some people in my inner circle that were becoming toxic or changing and going down not a healthy path. And it was pulling me out of my own alignment. And one of my top strengths is competition, right? So it's always important to know your top strengths and talents. One of mine is competition. So what do you think I do every day, all day long?
Yeah.
I compare.
Oh.
So when I see influencers, I see my friends on Facebook posting all this stuff, and I see all these people doing these things and doctors doing this with their career. I mean, I am in my head all day long comparing myself, like, why aren't I doing this? And I will say that contributes to a lot of depression. So I think my advice to somebody who is struggling with that is, stop comparing yourself to others. Compare yourself to where you were 5 years ago. Have you grown? Are you making better decisions? And have you learned? So I have to do that with myself every day because when my brain goes down that rabbit hole of, oh my gosh, Dr. So and so, oh my God, she did this podcast and she did this and I should be doing this and I need to be doing this. And then I call my team, I'm like, we need to do this. And I'm like, wait a minute, stop. Katie, like, you don't need to do that, right? You are enough, just who you are. And are you in a better place today than you were a year ago? Well, yeah, I am. So I think that's a good place to start.
That's a good place to start.
Yeah.
So thank you so much, Dr. Katie, for duking it out with me. Just kidding.
Thank you for your thoughtful questions. And I'm really grateful that we got to cover as much as we did on burnout and mental health and well being. And I just appreciate everything that you're doing for our audience and our people and our community nationwide. And I hope that anyone listening today has a better sense of the healthcare landscape, and then it's not them, it's not you, it's not your fault, it's a system problem, and there are many solutions out there. And so people are welcome to go to my website or reach out to me if they have any questions. And I just thank you so much for interviewing me today and being so
Thank
authentic.
you for being authentic as well. Uh, I think that you left, but is there one thing you could leave with the audience that will give them hope to? Um, I just, I don't know, just hope.
Well, I would say you are your hope. And I mean that deeply. You are your hope for us helping healthcare. If if you can help yourself and get yourself to a better place, spiritually, mentally, physically, emotionally, start with you, and it's a ripple effect, and it's very powerful. When you start showing up to work and you feel better about yourself, your self-esteem is better, you have a better handle on things, you understand what's going on, you understand that some of these work dynamics are not your fault, and you have a better understanding of how to respond to them and not take them personally. That's hope. As you start showing up and responding differently at work, you teach others how to respond more professionally and neutrally and not take things so personally. And it's a ripple effect.
That's awesome. Thank you so much, Dr. Cole, for being with us today at Scrubs Unzipped. And if you are listening and you want to keep in touch with Dr. Cole, the website will be in the show notes. And until next time, I will check you later.
Oh, thank you so much, Anna Marie, and thanks to all of you for listening today.